young people have been blamed a lot for the spread of coronavirus. Here's what young people had to say about that and about the effect coronavirus and the vaccine has had on BAME communities.
So lately, the people have been blaming children and teenagers for the cause of coronavirus and the race. So do you think it was a good thing for people to be blaming us, the children and teenagers, for the cause of coronavirus and the race of it?
Yeah, no, I think that was really unfair. I think there's always this tendency to kind of blame young people for stuff. I don't think it's true. I think like there was quite a lot of stuff around not just schools but like students and stuff, whether they're like having raves and stuff, and you got like these odd like examples where that's true. But in general, I don't think it's fair to say that like students and young people and children have like been the cause of rising COVID rates, because like there's so many examples of people of all ages like spreading coronavirus, and ultimately we're all just trying to do our best, I think. So yeah, I don't think it's fair to blame young people for like the rising coronavirus.
So if do you think the government could have done something better to help us, the children and teenagers, with coronavirus?
Yeah, I mean, I guess this probably comes back in some sense to schools and universities, and other learning institutions, like basically enabling them to stay open but safely. I don't think enough work was done on that. I think like schools did the best job they could, and like a lot of people did a lot of work on that. And to be fair, even when schools were shut, like physically, for some people, I know that it was still open for some people, and teachers were doing a lot of work like online, even if it wasn't as good like for students, because like that is kind of the importance of being at school and like seeing each other in person. So yeah, I think there just wasn't enough support for schools by the government. Really, there should have been probably more funding, and probably more actual investigation and like work along with like kind of the teachers' unions and students to kind of how it could have been best managed, which I just don't think there was enough of.
So is there any plan to influence the BAME community to push for the vaccine?
We have since the vaccine have been starting, we have been doing webinars with the public to ask any question, even sensitive culture questions, and we've been translating a lot of flyers and leaflets. Groups have been talking, certain messages have been passed on through WhatsApp and media. So yeah, we started since the vaccine have been introduced.
As like a community leader, obviously you're looked up to by not only the youth but everyone in your community. What have you done, or what challenges have you found during this time with COVID?
Yeah, with COVID, the first challenge I have is we had to shout out BAME first because we were ignored and the communities were ignored. And then the resources we had to use a lot of the grassroots organization to utilize the resources that the guidelines and the government or the council was giving. So we had to translate all the information. We had to and give and highlight a lot of vulnerable families that didn't have any food packages. We had to make sure that the domestic abuse victims were being protected. And we had to translate and support families that kept young children in the schools, and how some were struggling with laptops, some were struggling with educating their young kids at home. That was quite hard. Also educating the communities about frontliners, NHS frontline workers, and how much they're working really, really hard. So we had to, as community, contribute towards the NHS as well, and make sure that we recognize clapping for them, or praising them, or whatever we need to do, or making their life a lot easier. For me, it's about conversation. It's about talking to the parents and say, you need to think about vaccine. You need to talk to your young people. And we still got a long way to go. Yeah, we still got a long way to go to make the community a lot more safer.
what is the plan to influence the BAME community to push for the vaccine in the future?
So there's plenty going on already. So that plan is well developed and being implemented, has been for months now. And in short, it's working with community and faith leaders in BAME communities, so that they are the message deliverers, not me. Because I'm a middle-aged white bloke. Who's going to listen to me?
Right.
And me standing with a megaphone outside the town hall saying Black and Asian people should be vaccinated. Well, people just laugh. So it's really, really important too. And we are working with faith and community leaders from BAME communities up and down Sheffield to be responsible for delivering the message, and not just faith and community leaders, but using all sorts of social media in ways that are way beyond my limited social media technical capabilities to get to communities and get messages to communities that we just wouldn't otherwise get to, and that seems to be working. There is still a gap between vaccination uptake in white communities and Black and Asian communities, for instance, and the gap is probably in the order of about 10% coverage. I would prefer it to be 0%. There is still a gap, but certainly the gap is less than I thought it would be and feared it would be. It's hard to think of something we should be doing that we aren't doing, but I'm always up for suggestions if people have got bright ideas.
Right. And how important do you think that? How important do you think it is to get the right message across? Because now, in this day and age, the media and stuff, like people are easily influenced by certain stuff. So
it's hugely important. So we've all seen the interesting theories that circulate on lots of forms of social media. I can only cope with Twitter, but I know there are plenty of others, and all sorts of theories circulate all the time. Most of them are really, really interesting theories. Right. None of them are true. Ultimately, we all believe what we want to believe, and I can't force anybody to believe anything. But when we all believe what we want to believe, and that is influenced and shaped by what others tell us, by what we see on all sorts of media, both social media, print media, and broadcast media, and then thus it becomes important to sort of be selective as to where you get your information from. I usually only point people towards either the Public Health England website, so a website that ends in gov.uk. Or to be fair, the BBC website is brilliant and has a whole load of really, really helpful information. There are other websites with lots of good information, but those are the two that I usually point to because I know they're quality checked and quality assured. As I say, I nor anyone else can force people to believe in any one thing, and we all choose to believe what we choose to believe. But my sort of kind of message is be careful what you read and kind of think hard about whether or not it could be true.
Yeah.
So, besides this, what do you think the funniest rumor is about the COVID vaccine?
Nanobots.
Nanobots. Could you go into some depth on that?
So, for some reason, the government's trying to put a whole bunch of nanobots in this vaccine to control us, or monitor us, or whatever it is. The first question that I've got to ask myself is, how much do these nanobots cost? Mm-hmm. It's getting put into millions of people, so that's a hell of a lot of money to invest in, whatever. And then who's monitoring all these nanobots?
Of course, yeah.
So eventually, if somebody's monitoring these nanobots, it's gonna leak out into the kind of. I don't think it's happening. I don't think it's happened. I just think it's ridiculous. But it's also one of the things that has stopped people from taking the vaccine.
The wildest thing I've heard is that the vaccine was produced in China just to keep the poor people poorer and the rich people rich, and avoid the poor people from working and avoid them from developing their abilities and expanding out from where they're.
That's another ridiculous one, because the rich only get rich because the poor work. Yeah. Mm-hmm. And then also we didn't need an epidemic for that.
Yeah.
They've got so many different devices and ways of getting our money out of our pocket nowadays. Mm-hmm. It's just ridiculous. Like, I actually think it is ridiculous. Like, how much money comes out of my pocket without my permission. Mm-hmm. You know what I mean? Yeah. So why would they need a pandemic to stop that? And all right, have a look at it from another point of view on this. We ain't had no festivals. We ain't had no nightclubs. We ain't had general fun. We haven't been out. We haven't been using petrol, all that kind of stuff. So that theory is a bit out there.
With the information as well, I know that there's some misinformation with the vaccine or not. I don't really know the ingredients, but people who are allergic to nuts and stuff can have bad effects. And also there's hints of alcohol in it. And I know that in the Quran and stuff like that, it's like no alcohol, stuff like that.
Yeah, there's no alcohol, but there is in every I think the jab has got a tiny alcohol in there. But we've researched and we've asked the mosques and everything, and the sheikhs, they said it's halal, it's significant to nothing. And they themselves had the go ahead. So Sheikh Muhammad Ali Maulid in Manchester, he was always our sheikh, our local imam, and we've asked him, and he was very proud to go and get the vaccine done himself, to reassure people they should be having the vaccine done.
That's good. Obviously, I'm someone who's quite scared of the vaccine, but it's giving me reassurance hearing about it. I can't lie.
It does.
So,
the youth, I feel like they're not always willing to take stuff. Like, for example, the vaccine, they're not willing to take the vaccine because they've seen a lot of stuff on social media, and I feel like they might have been misguided by social media. What would you say to youth that are uncertain on taking the vaccine, or like listening to the rules or the guidelines?
I would say that they need to get their information from the NHS website, or to speak to their local GP, or to go to the test centres and ask questions there. There are amazing people giving out so much information. They need to be having a debate or thinking about it. They need to stick to a certain conversation. But if they go through off topic in terms of saying, why is the COVID going on? And, there's a lot that it's right now, it's about your self-care, your self-duty to yourself and your family, and how to keep yourself safe from this thing that we don't understand where it's come from. But if you want to talk about the vaccine, I think a health professional would be the right person to ask for, because they're detached from you. They don't know you, so they won't influence you in any type of form. They will give you the facts. And it's up to you what you go with that facts. And having family discussions is really good, and you go from there. Reading about it is a lot big, but it's where you read it from. So the government website is the best thing that gives you the guideline.
A huge thank you to Sheffield City Council for funding this project, to all the young people who got involved doing the interviews and asking questions on social media, to the One Devotion for providing interview training for our young people, and of course to Safia, Martin, Greg and Lloyd for coming in and speaking to our young people.